With this week's Eye Care Update, I'm Gretchen Bailey, Editor-in-Chief and Content Channel Director of Optometry Times. More than 1,000 eye care professionals from across the United States are now certified and able to prescribe CooperVision's Brilliant Futures myopia management program, featuring the MiSight one-day contact lens as its cornerstone, according to CooperVision. These doctors serve children and families in 45 states. Each eye care professional successfully completed a virtual exam and then activated their account to receive fit sets and patient starter kits, according to the company. CooperVision's MiSight one-day contact lens is the first soft contact lens in the United States that the U.S. Food and Drug Administration has approved for slowing the progression of myopia in children who at initiation of treatment are 8 to 12 years of age. In related CooperVision news, the company has named television actress, producer, and entrepreneur Sarah Michelle Gellar as the spokesperson for its Brilliant Futures myopia management program. This new multi-channel direct-to-consumer advertising campaign will feature Gellar to highlight the importance of annual comprehensive exams and monitoring the progression of myopia in children. The campaign will include national and regional broadcast segments, content across digital and social media, and influencers who will be sharing their personal experiences with myopia. Researchers in Belgium have developed an artificial iris embedded in a smart contact lens that will spin off into a startup company. The team at IMEC and CMST, an IMEC-affiliated research group at Ghent University in Belgium, developed a tunable iris aperture using concentric rings on an integrated liquid crystal display, or LCD. The technology will spin out into a startup called Azalea Vision. The smart contact lens is designed to operate for an entire day using an ultra-low power design to compensate for iris problems such as aniridia and photophobia. The artificial iris lens is capable of dynamically changing the pupil size, bringing back two levels of functionality of the eye: light adaptation and expanded depth of focus. Hospital eye care waiting lists in Ireland have increased to 52,000 people during COVID-19, with the Association of Optometrists Ireland calling the waiting list, quote, out of control. The association has called for new plans to be rolled out nationwide to support the delivery of eye care in the community and to help reduce hospital waiting lists. Figures from the National Treatment Purchase Fund up to July have revealed that 43,000 people were on the outpatient eye care waiting list. This is an increase from 41,200 people at the end of 2019 and 40,600 people at the end of 2018. Another 9,100 people were on the waiting list for inpatient eye care procedures, which is an increase from 7,700 at the end of 2019. New England College of Optometry has released Octavia 2.0, a smartphone app for optometry and ophthalmology. The app is now available for Android devices, in addition to the previously available iOS version. Octavia, which stands for Optical Coherence Tomography Visual Atlas, is a collection of OCT images and reference information for ocular diseases and retinal conditions. The upgraded app includes expanded entries, additional images, and easier search. The app was developed by Dr. Elena Z. Biffy, Associate Professor of Optometry and attending optometrist at South Boston Community Health Center Eye Clinic. For a small fee, users get access to the full content with over 100 different ocular diseases and automatic monthly content and reference links updates. The original app was launched in 2018 for iOS users and has been downloaded close to 10,000 times worldwide. Aldera Therapeutics has received a study may proceed letter from the U.S. Food and Drug Administration to begin a phase 2 clinical trial evaluating ADX629, a novel orally available reactive aldehyde species, or RASP, inhibitor for the treatment of adult patients hospitalized for COVID-19. The planned phase 2 clinical trial is expected to enroll approximately 30 patients with COVID-19. Patients will be enrolled upon hospitalization for COVID-19 and treated with orally administered ADX 629 or placebo twice daily for up to 28 days. Key endpoints will include the National Institute of Allergy and Infectious Diseases COVID-19 scale and levels of cytokines and RASP. In a cross-sectional study of 216 children hospitalized with COVID-19 in Wuhan, China, 49 children, or 22.7%, had ocular manifestations, including conjunctival discharge, eye rubbing, and conjunctival congestion. Children with systemic symptoms or cough were more likely to develop ocular symptoms, which were mild, and recovered or improved with minimal eye drops or self-healing. The study recently appeared in JAMA Ophthalmology. Researchers concluded, quote, there is still no specific medical treatment for COVID-19 related ocular disorders. However, as shown in this study, ocular disorders in children with COVID-19 are typically very mild, children recover rather quickly, and these disorders are not associated with long-term complications. Most individuals with ocular symptoms recover spontaneously without any treatment. Therefore, we recommend only close observation for COVID-19 related ocular manifestations in children. Cooper Companies, along with its CooperVision and Cooper Surgical divisions, has been named one of Fortune's best large workplaces in manufacturing and production. To determine the companies selected for this list, Fortune research partner Great Places to Work analyzed responses from more than 160,000 employees at Great Places to Work certified organizations in the manufacturing and production industry. Employees responded anonymously to more than 60 survey questions rating their employers, assessing workplace culture, employee experience, and leadership behaviors. Bausch & Lomb One by One recycling program was recently recognized as a Gold Stevie winner for the Environmental Campaign of the Year in the Communications or PR Campaign of the Year environmental category and Sustainability Leadership Award organization winner as part of the Business Intelligence Group's 2020 Sustainability Awards. This honor recognizes companies making sustainability an important part of their business practice. Now, Dr. Jake Lang examines the interaction of ocular surface disease and IOL technology, and Dr. Whitney Hauser offers her take on challenges and opportunities in dry eye in 2020.